Hello everyone, my name is Bakukele Brian Situnda. I'm a fourth year paramedic student at the Nelson Mandela University. Today we are joined by my lecturer, Mr. Travis, who's representing the department. Hello sir.
How's it, Brian? How are you doing?
Good, thanks, and yourself.
Good.
Could you please introduce yourself and introduce the program that you're presenting today?
Okay, so my name is Travis Trower. I am a senior lecturer at the Nelson Mandela University. I lecture on the 4-year Bachelor's of Health Science degree. Essentially, to most people, they know it as becoming a paramedic. Our course is run, as I mentioned earlier, over 4 years. It is both on the Summer Strand campus in Ocean Sciences, also at Mission Vale campus in Mission Vale.
Okay. Thank you very much. And for anyone who wants to join the profession, could you then tell us what does the profession involve?
I think the profession is quite diverse. I don't think everybody necessarily always knows what the world of a paramedic actually involves. During the 4-year degree, they both cover both the medical component as well as a rescue component. We like to prepare our students both mentally, physically, and psychologically for the career that they're going to face. So essentially, in the first year, they do the basic medical stuff and the core components, and then in the second year, they actually start with the medical rescue lecturing as well. Over about 5 days of the week that the students are busy, I think each year does at least 1.5 days of rescue, and the rest is either spent doing the medical side of things or with their work integrated learning on the road.
Okay, thank you very much for that. Now, after what you've said, I'm interested in joining the profession. Can you tell us more about the requirements that I need to join the course in the university?
Yes, so applicants should have grade 12 mathematics with a score of at least 370, an applicant score of at least 370. If the applicants do have math literacy, then they need to have an applicant score of at least 385. They must also achieve at least 50% in mathematics or 65 in mathematics literacy, 50% in physical science, 60% in life sciences, 50% in English, and they must have all 4 subjects in order to qualify to be accepted onto the course.
Okay, thank you very much, sir. As a 4th year student, when I started, we did the physical assessment, and I personally was not a comfortable swimmer. And for someone who would like to join the course and they're also not a comfortable swimmer, what measures do you guys have to make sure that they progress in the swimming?
Okay, so first of all, if somebody is not a strong swimmer or they can't swim at all, we definitely don't exclude them from the program. Okay. It's one of the reasons why we only start rescue in second year. Okay. So what we essentially do is they just mustn't be terrified of being in the water.
Yes.
So as long as they're able to be in the water, they don't necessarily have to swim. What we will do is in their first year of study, we provide them with a swimming coach as well as contact sessions with that swimming coach, both in the mornings and in the afternoons. And all the student really needs to do is show up for those training sessions. If the students show up for those training sessions and they practice, by the end of the first year they're already starting to be swimming proficient. Then throughout the 4 years there is a swimming assessment for first, second, third and fourth year. It happens 4 times a year and it's weighted accordingly. And then in their third year of studies, before they do the actual aquatic rescue module, there's a little bit of a different swimming assessment that they need to pass. But to answer your questions, there are measures in place to support the students and to assist them through that. As far as I know, we are the only university that has a full-time swimming coach to assist the students with swimming.
And on that, it is very true. When I started, I was not a comfortable swimmer, but I'm happy to say now that I'm quite good in my swimming. Another often question that we get is any alternative application routes for those who are already in the field, but they want to further their education. Could you please explain how those people could do that?
Yes, Brian. So there is a pathway for other students that do have a previous qualification. Essentially, we have what they call RPL, so recognized prior learning. So the best thing is to once those qualifications that have been completed, send the certificates through to our departmental secretary, and she'll do a follow-up email and give them advice on how they can move forward from there.
On that, the email is info.emc@mandela.ac.za. Another question I would like to ask you, sir. As a student myself, I know that there is a difficult transition from matric into university. Could you tell us what should the the students expect when they're in the course?
I think especially for our 4-year degree, I think what the students should be expecting is it's going to be hard work. It's early mornings, it's late afternoons.
Yes.
Very often they're working on the road on Saturdays and Sundays. It's quite a harsh introduction into real life, but the reality is now once you finish matric, you're becoming an adult, and now you're going to pursue a career. Emergency medicine is a passion. And I think if the students are willing to work hard and willing to be present and follow the correct supportive structures that are there for them, it'll be a relatively easy process or easy transition. You often see the students that put the time in are the ones that are very successful at what they need.
Thank you very much for that. And for the student that is already accepted in the course, could you explain to them how does the course further develop on?
Okay, Brian, so as I mentioned earlier on, in first year, they're basically only doing the medical modules and doing some of the physical preparedness to get them ready to start the rescue. As they move into second year, things do start to be progressively more, I don't want to use the word difficult, but it requires a little bit more time and work from their side. And as they go through through second year with the rescue, they develop certain rescue modules that assist them going into their third year, and that works the same as they go into the fourth year. So as they go through all 4 years of the studies, we slowly start growing that human being into a paramedic, and they start to developing that. At the same time, they are also go out onto the road, they get work experience, which obviously also increases their confidence and helps them to assist their learning process.
Thank you.
Brian, would you like to tell everyone about the career opportunities that have been made available to you or that you think will be made available to you once you qualify?
Gladly. Graduates register as independent emergency care practitioners with the HPCSA, which is the Health Professions Council of South Africa. We can work on the road, on the government, which is public or private EMS. You can work on cruise ships, you can work overseas, you can work in the country. You can also venture off in academia, where you can be a lecturer in the EMS colleges across the country or in any university that provides the course. Yes, so as an EMC graduate, you are unlikely not to get a job. 3 months max. After that, you'll definitely have a job. On that, thank you very much, sir, for joining us today. For anyone who'd like to learn more about the program, they can visit our website. It is emc.mandela.ac.za. Alternatively, they can send an email to info.emc@mandela.ac.za. Thank you very much.